Now let's discuss this and the country's looming fourth wave. We are now joined via Zoom by Principal Medical Scientist at the National Institute for Communicable Diseases, Dr. Jinal Bhiman. Dr. Bhiman, thank you so much for joining us this afternoon. Now, could the C12 variant be the driving fourth wave of infections in the country? Perhaps explain that question, and also what are some of the other drivers that you found?
Good afternoon. Thank you for having me on the channel today. So the C12 variant is currently circulating at relatively low frequency in South Africa, and it doesn't appear to have some kind of advantage over the Delta variant. I would say that both of these variants were present during our third wave, and definitely the Delta variant had some kind of advantage and has been causing the majority of infections. So it's difficult at this stage to really say whether C12 would take off in a potential fourth wave.
So talk to us about how much do we know at this stage about the C12 variant?
So all we know at present is what we see from the sequence data. So we know that it has accumulated a large number of mutations. Some of these mutations are shared with other variants of concern, like the Delta variant, like the Beta variant. But then there are other mutations that are unique that haven't been seen before in variants of concern or variants of interest. What we don't know at this point is what is the functional impact of those mutations. And those studies, unfortunately, take a little bit of time, so we're still awaiting those results.
Now, Doctor, I want you to explain just very briefly around the test positivity rate. South Africa, as I said in my intro, we're sitting at 12.3% in the last 24-hour cycle. But we know that this is still twice the rate at which the spread of the virus is considered to be under control. Talk to us around where the numbers should ideally sit.
So I think ideally we want it to be relatively low. We want it to be less than 10% ideally. I don't know really how we're going to see this coming through, apart from, potentially following all the non-pharmaceutical interventions that we can to date. We just have to ride this wave out at present. We've seen how in Gauteng the numbers have come down quite drastically. Test positivity rate has come down quite drastically. And then it's just a couple of other provinces, KwaZulu-Natal in the lead now, where the wave kind of is still coming down. I think we should see this in the coming weeks if everything goes according to predictions.
Now, it does sound very promising that these numbers are coming down, which would probably what we would be expecting to hear from President Cyril Ramaphosa sometime this week when he addresses the nation. But talk to me about your concerns around the death toll. I mean, whilst the numbers are coming down, we've heard from the Premier of Gauteng saying that the province is officially out of the third wave, but the death toll remains high. What can we make of this?
I think obviously a large reason why this is continuing is because our hospitals are still overwhelmed. Even though the numbers come down, for deaths to be reflected, it still takes 2 weeks, after those initial kind of coming down numbers, because that is the trajectory that this virus follows. And a lot of cases obviously as well spend a little bit longer in the hospital. And so that really is why the death toll kind of lags, and we still see this high death rate that we're seeing now. So even though the third wave is over in Gauteng, the impacts are still being felt, and that's really how we explain it by the pathogenesis of this virus.
Now, we're seeing a lot of campaigning as it relates to, people being vaccinated, people being encouraged to vaccinate. I mean, there are quite a number of developments that are going to be happening right around the time that this fourth wave that is predicted will be happening. Talk to me about realistically, how will we be looking with the numbers still low in terms of, people being vaccinated per day? We're still not meeting government's target of 300,000 per day. We're sitting at around 200,000 or so. so. But the fourth wave is likely to hit in November, we're told. But also we know that the election time is around about that time. What are some of the concerns around, will we have reached herd immunity around that time? We know that the date of April or February of 2022 was earmarked. What's your thoughts around that?
So I think, the growing body of evidence globally is that herd immunity as we thought we could achieve is really not possible. In large part thanks to the emergence of new variants that are more transmissible than what was originally thought, that are obviously harboring immune escape mutations. The herd immunity is seeming to be more and more distant and more unachievable. At this point, what we need to drive home is that every person should try and get vaccinated to prevent severe infection, to prevent hospitalization and death. That's really what we want to now aim, because vaccination at this point is not preventing infection anymore, and we're not going to be able to see, where we get, for example, 70% of our population being immunized and thereby protecting the other 30 that are not. This doesn't seem to be something that can be achieved at this point from the global evidence that we've seen. And like I say, all because of new variants emerging.
Doctor, there's a lot of misconception and misinformation that is spreading around vaccinations, which is probably why there is a vaccine hesitancy and why we probably need to educate more people. But there are those that are adamant that, after vaccinating, they've become extremely ill. Some have even claimed that, some of their loved ones have died straight after vaccinating. What are some of, the misinformation that is spread out there that is related to vaccinating and death? If perhaps you can just give us clarity around that.
So, just to clarify, when you are vaccinated, whether you're a child, whether you're an adult, we give vaccines to our kids when they are still under 2 years old, for example, your body is making a response to that vaccine. You're putting a foreign particle into your body, which is a little tiny piece of the coronavirus in this case. And so your body recognizes that as something that is not itself, that is something that is foreign, and it starts making this response to the foreign particle. Now, in some individuals, especially with the coronavirus vaccine, it's quite a range of kind of side effects that we see. But in some individuals, you're right, there is quite a strong response because your body is working to kind of make an antibody or make a T cell response to this virus. And actually, if you have a good response that you yourself notice, that generally correlates with a good immune response. It means that your body is actually doing something that will be helpful to you in the future when you're exposed to this virus. So in that situation where somebody is feeling particularly under the weather, the best advice I can give is to take a day off, take a sick day off, rest and let your body recover, let your body do what it needs to do to develop these responses so that, the vaccine does its job in the future. But in terms of the vaccine causing death, in terms of the vaccine causing illness, especially prolonged illness, that has not yet been proven. That has not been shown to be true. And so where individuals are feeling this, that they've had a severe and adverse effect, they need to report. They need to report these through EVDS to their doctors, to their vaccination sites, so that they can be followed up, so that we can investigate and see, is this being caused by something else? Is it actually being caused by the vaccine, which to date I don't think has been shown.
All right, Doctor, thank you so much for your time this afternoon. We really do appreciate that. That was a principal medical scientist at the National Institute for Communicable Diseases, Dr. Jinal Bhiman.